Hello and welcome to today's lesson. Hope you're all doing well. And just to remind you all, like I put on the assignment area, like I put on the post area, if you've got questions about any of this work, just ask it. Just ask them. If you've got one right now, pause this video, go straight into the Teams chat, send me the message, and I'll be straight there to reply to it. Even if you're working at whatever time of day you're working, I know we've got people that are working all different times of the day, just send me a message and I'll reply as soon as I'm next online. So for today's lesson, like always, you'll need the worksheet from the assignment area and you'll need to listen to this video and stop for the activities as we get to them. So today we're looking at the Liberal reform, so who benefited and how. Remember, if we're linking this into our factor questions, that big 20-mark question we get in every exam, this will be the role of government. Liberal reforms links into that public health factor. So public health factor is what are different groups doing to make sure that the general public are as healthy as they can be. So that's what it means when we're talking about public health. So just to start off with, as always, some recall questions. So we've got, how do the following factors link together in the development of surgery? So we're thinking about those factors of war, science and technology, government and communication. So how can we link all of these factors to individuals? So I'll give you a first example. We could talk about the individual that is Paré and how that war is a factor he links to because it's in war where he made his advancements. So that's what we're looking to do. Have a go at that for war, science, technology, government and communication, and come back when you're ready for some answers. So make sure that you green pen up your work. Some of us are brilliant at doing this. Every week I can see on all of your assignments you've got your green pens in any gaps. Make sure that if you haven't been doing it, you are doing it. It's important. If you're not writing it down, it's going to be harder to remember. So if we're thinking about warfare, we've got people such as Paré, Giles, and Mackindow. Remember, Mackindow from our previous lessons is the surgeon during the First World War that did plastic surgery to heal soldiers. When we're thinking about our links to science and technology, we've got individuals such as Simpson and Lister, so that's where we've got anesthetics and antiseptics. How can we link it into government? We're looking at the influence of blood banks. Remember, we get our national blood bank set up. Communication and individuals. So communication allows you to spread ideas easier and quicker. So in the medieval period, we've got the printing press. As we get into the industrial period, we start to get the telegraph, which is, it's like sending text messages but by phone lines. And then we are getting into the modern period. By the time of the First and Second World War, we're starting to get radio and telephones. So, our intent, looking at our learning journey, the big picture. As we've already seen from the starter, what we're doing today links back into our previous lessons, and you can see we go right the way back to the beginning of medicine. So we'll be comparing right the way back to the idea of Hippocrates, comparing to Paré, comparing to Lister and Simpson. We're seeing how ideas are changing over time. This even links right back into things you might have done in lower school. So the liberal reforms, you will have covered them in year 8, and they will have linked into some of the ideas that you might have seen during your conflict and tension interwar unit, where we've seen things that the government might have been doing. Who influenced and who benefited from the liberal social reforms of 1906 to 1914. Our objective today is to investigate who influenced and who benefited from these liberal social reforms. When we say a liberal social reform, what that means, liberal is about opening something up to give everyone access, and social is about the people, and reform is about changing and the structure. So what it means altogether is you're opening up all of the things that the people might need to try and make their lives better. So for example, access to schools, access to healthcare, those sorts of things. Our outcomes are to outline the early 20th century liberal reforms, so that's what we should all be aiming to do, just to give me an idea of what they were. Silver, to explain the success of the reforms and to explain who benefited, so that's where you're starting to sort them into different categories. To evaluate key individuals involved and their developments made, so we're evaluating them, so we're talking about who's important, who did what. And for platinum, we're looking to analyze and evaluate the importance of different factors in the development of surgery. That's that skill that we're all going to be focusing on as well, that being able to group things into different factors and to be able to talk about them. It's really important. If you want the top half of your marks in that last question, you need to be able to talk about different factors and draw on them together. So you need to be able to say that individuals were able to do this, but only because they had the support of the government, or because they benefited from enhanced communication or better science and technology. Just by being able to put that extra bit in, linking them together, pushes your marks right up. So it's really important that you're able to do that. So, our starter today, can you watch this video clip? You should be able to watch it on your worksheet just by clicking on it. If it won't play in your worksheet, follow the link to the YouTube video. There's four areas of focus that I want you to think about whilst watching this. So what were the liberal reforms between 1906 and 1918? Why were they passed? What was their impact? And do you think they were a success or failure? So make notes on those four topics whilst watching the video, and then come back once you've done that. So we'll build on what we've learned in that video in a minute, but first I want us to look at this graph before I've given you some background, because I want you to jump into this on your own. So we've got 4 questions to look at. What happened to these children's weight in term time? What happened to children's weight in holiday time? What does this suggest about providing free school meals means for these children that needed them? And does this source prove that the liberal reforms worked? So I'll talk over a few things just so you're not going in totally blind. So this source is a report from Bradford City medical officer on the effects of school meals in 1907. So we know it's when our liberal reforms are coming in. Down this side, so on our y-axis, we've got children's weight going up, so from 1 up to 1.5 kilograms gained. And along here, we've got our months of the year, and we know our school holidays are here, so this last grayed out column, so the last week of August last week of July into August is our holidays, and this week here is our half term. So the first grey bar is half term, and then the big bar is the end of term. The black bar shows their weight. So if the black line goes up, that means weight's going up. If it goes down, weight's going down. So have a go at looking at those questions. If you're still listening and that's because you're stuck, have a think about why this might drop. Why might that go to a low point? Have a think about that. Have a go at the questions and come back ready for some feedback. Okay, welcome back. I'll swap over to green pen for this part. So we can see free school meals are introduced, and we can see in the first 6 weeks of them being in. So here's where they come in. Children's weight shoots right up. So in the first week and a half, really, of them being in, we can see children gain weight. If we want to be a bit more accurate, we can read off the axis on our graphs. We can see they start at 2 and they jump up to 7.5. So you've got your increase of 5.5 kilos straight away just by them being brought in. As we keep seeing, it levels off, but it keeps going up. Then we get to the end of term time. And the answer to our first question, what happens to their weight during term time? It goes up. What happens during the holiday? Their weight drops off here. So we can see that there's a dramatic drop in the children's weight when they're not at school. What does that suggest about providing free school meals? It suggests that it works during term time. What else does it suggest? It suggests that it isn't working when children aren't at school, because they're not getting access to the same amount of food when they're not in school. Does it prove the Liberal reforms worked? It shows they worked to an extent, because we can see again, once they're back from half term, their weight goes back up again. But then we can see, once we get to the summer holidays, their weight drops back down again. So it shows whilst they're in school, the children are benefiting, but when they're not in school, they're not helping them. This dotted line shows us where they would be without the free school meal. So we can see they're doing a lot better than children that don't have access to free school meals, because even when they drop back down, it's like they're at our low point, they're still well above the line for where someone who didn't have access to free school meals is. So it shows that they are working. Okay, so this is just what your worksheet looks like. Our next task, we're going to have a go at bingo, so filling in our bingo card to see who can get that done. So there's two different ones of these like normal, so we've got the bronze and the silver version and the gold and platinum version. I'll show you how both of those work. There's also some challenge questions here which you can write on. You've got this on your worksheet and it'll look the same as I've got up on screen. So this is what your bronze silver task looks like. What you do, you read the question, you'd go to the information sheets and you'd find your answer. So for example, what percentage of recruits were rejected during the Boer War? That would be 36%. So you'd find that on your information sheet. It's on the third information sheet for you, and you'd have a look at that. At what age could people get an old age pension after 1908? I'll show you how we could find that one next. Gold and platinum, it's exactly the same. So we're looking for at what age could people get access to an old age pension. So we'll have a look on our timeline. An old age pension was introduced for the over 70 in 1908. So we know that in 1908, the over 70s got access to old age pensions. So we'd go back to our bronze silver worksheet and we'd fill that in. And it's exactly the same technique for gold and platinum. These are all of your information sheets, so you've got these on your worksheet for you. That's where that 38% from earlier comes from. So 38% of recruits are unfit to serve. And our final information sheet is here. So have a go at filling in as much as you can on there. Don't spend more than 10 minutes on this task. If you haven't done it in 10 minutes, just stop where you are, come back for the feedback, and we can fill it in with green pen. So, what percent is unfit? So, as we've said, 38% can't serve their country on medical grounds. The old age pension is introduced for the over 70s who don't have enough to live on. We've got the National Insurance Act, which is to help provide for the sick. Rowntree, so he's an important man, owned a chocolate factory, as in Rowntree is like fruit pastels. So he had his factory up in York. He realised that the scale of poverty in York was a quarter, so 1 in 4 people were living in poverty, and he used that information to put pressure on the government because it opened his eyes to let him understand just how bad it was. Two examples of things taught in medical schools for mothers, so the importance of diet and how to avoid infection and diseases, so they've got to keep clean. Which two groups paid into the national insurance apart from the workers? Your government and your employer. So the worker, the employer, and the government would all pay into the national insurance system, and that would help provide sick pay. 3 ways that Booth influenced actions of the Liberal reforms. So we discovered there was a 35% rate of poverty in the East End of London. He put pressure onto the government about this, and he used his first-hand experience in arguments. So the fact he'd been there into these places where people were living and he was able to describe them was very helpful in him making arguments. 3 examples of how children benefited from social reforms. So like we've seen in our graph earlier, improved diet, improved healthcare, so we've got medical checks for children, and infant mortality fell. So infant mortality is the rate of death dropped for children. And 3 groups of people that didn't benefit from the National Insurance Act. We've got the families of workers, particularly women and children, the unemployed, the elderly, and anyone with a long-lasting illness, because you would lose your job and then you wouldn't be covered anymore. Gold and platinum, there's a few different, so I'll just go over the few that are different. So David Lloyd George is key to the Liberal reforms. He is the Chancellor of the Exchequer. He is the man that is in charge of how the government spends its money, and he was influenced by both Rowntree and Booth. So the government feared that the poor health of the country would leave both the country and the empire unable to defend itself. So like we've seen with the Boer War, if 38% of the people aren't fit to fight, that leaves you in a situation where the empire can't be defended. If you were elderly and you weren't able to get support before 1908, the only government support you could get was for going into a workhouse, and you'd have to work for your keep. The National Insurance Act of 1911 is a great change because it gives access to medical help and sick pay for those that can't afford it. The death rate of children under 1 year old between 1840 and 1940, it remained high, with 1 in 7 babies dying before their first birthday, but it did decline, so it started to drop. Where are we up to next? We've done the next two, we've done the third. So in terms of our last one then, so it's in the National Insurance Act. As we've said, it doesn't help women, doesn't help children, doesn't help people with long-term illnesses. So that's all of these covered. And finally, just before we end, this should just take you a couple of seconds to do before the end. We've got a memory aid for you, so something that's going to help you. Opens will help you. Will help you remember the Liberal reforms brought in by Lloyd George. So can you put an explanation by each one, just explaining how they're linked? So old age pensions, who did they benefit? Pensions, how did they benefit? Education for mothers, what was the benefit? National insurance, and school meals and medical checks. So how did people benefit from all of these things? Just really quickly, it's a short bullet point on that last slide. So next up in our unit after this lesson will be the lessons where we look at the impact of the world wars. How did it affect public health? How did it affect people in poverty? How did it affect people's access to housing? So that's where we'd look at next. And finally, linking into your careers. So how will this help you in the future? So a job you can do with your history skills is to become a curator in a museum or in an art gallery. So a curator can earn between 18,000 to 25,000 a year, with high-level curators earning between 26,000 to 35,000. The skills that link into history are they are good at evaluating, they're good at selecting what's important, arranging the materials different. So all skills that we're doing all the time in history, they're just doing that with whatever's in their museum. So it might be something that they've learnt about, or it might be art, either of the two. So that is the end of today's lesson. If you've got any questions about anything at all, just send them to me. Just send your question right now. It'll come through to me and I will reply. You can do that in email or Teams chat. Apart from that, that is the end of the lesson.